Hi, good afternoon. I'm here at Mid Valley South Key Road Show. So this is a public sharing session by me. So my name is Chia. My topic for today is myopia control going beyond single vision correction in children. So I'm a UKM graduate of many years ago, and also I did my master's in UKM. Before I start, allow me to introduce myself. So as mentioned just now, I graduated from UKM many years ago. So I did my master's, and subsequently I was lecturing with Sagi University. I've also lectured with UCSI University. Apart from that, I've also done training for Bosch & Lomb, for Bolton Optical Group, and I'm also very active with the Association of Malaysian Optometrists. So with Association of Malaysian Optometrists, I was their secretary, their newsletter editor, and also organizer for a few major nationwide seminars. So what is myopia? Myopia is short-sightedness. In Chinese we call it 近视. In Malay we call it rabun jauh. So it is a condition where your eye focus is in front of the retina, and you cannot see close and cannot see clear at far. So how quickly does kids' eye myopia progress? So as you can see in this chart here, we can actually see that the Asians progress faster than the white. We can also see that the younger you have myopia or short-sightedness, the higher your annual progression. So meaning if you are a 7-year-old with myopia, you will have an annual progression of 1.12, and if you are a 12-year-old with myopia, you have onset of myopia, you will have a progression of 50 a year. So the progression is not equal across board. It is actually higher if you have your short-sightedness earlier. So it is actually massive. It has massive impact on many things. To name a few, it affects individual health, it affects quality of life, it compromises road safety, and it also impacts socio-economic growth. So there's 80% of what we learn daily, especially in a child, is through their vision, through their eye, and 1 in 3 child cannot see the blackboard clearly in class. So this is actually quite alarming. So as you can see here, these are the main causes of blindness in the world, and we can actually see that unaddressed refractive error is the main cause of blindness across the world. So it is actually quite important for you to have regular eye checks to find out whether your child or you have any uncorrected refractive error, and it is the main cause of visual impairment in the world. So more than 75% of visual impairment or blindness is avoidable. Why? Because most of this is caused by uncorrected visual impairment, corrected refractive error, meaning power. So this is the world map. We can actually see here that there is a difference between the prevalence of myopia, the appearance of myopia throughout the world. In the West, the US and UK actually have about 50% myopia, whereas if you look at in the East, especially Eastern Asia, we have 60% in Japan, 80% in Hong Kong, 74% in Singapore, 97% in South Korea. So it is actually quite high, quite alarming. Almost more than half of the population is myopic or short-sighted. In Malaysia, we have studies done, not very recent, in 2017, where we actually saw 42% myopia prevalence among Chinese Malaysian, and 15% prevalence of myopia among Malay Malaysian. So now in 2050, it is expected that it will increase from about 33% now till about 52% in 2050. So half of the world is expected to be myopic by 2050. So high myopia at the moment in 2020 is about 4% of population, world population, whereas in 2050 it will be 10%. So 1 in 10 person will be highly myopic, more than -6 by 2050. This is actually a very alarming figure because high myopia lead to a lot of diseases, increases your risk. So what do we need to know about prevalence of myopia? Asian children progress 50% faster. Myopia is higher, or you have a higher risk of myopia if you have parental history of myopia, if your parents are myopic. And also if you have 2 myopic parents, your myopia tend to be more prevalent, or you get myopia easier. So risk factor of myopia, generally genetics, that's one of the strong factors. So if you have parents with myopia, you tend to have myopia. Education level, the higher your education level, the higher your chances of myopia. Near work, we should limit our near work after class, especially for children, to 2 hours a day. And also lack of sun exposure. This is a light dopamine theory. So what happens is if you actually have sunlight exposure, it will cause the secretion of a hormone called dopamine, which will actually halt or stop the eyeball elongation, controlling myopia. So every day there should be at least 1 to 2 hours of outdoor sun exposure in a child to control myopia. So risk of high myopia, we have posterior vitreous detachment. This is relatively benign. It's the jelly within the eye separating from the back part of the eye. Then we also have retinal detachment. This is 视网膜脱落 in Chinese. It's actually a detachment of your sensory retina from the back part of the eye, causing visual loss. We also have glaucoma. You can also get glaucoma with myopia, higher risk of glaucoma. So glaucoma is high eye pressure causing nerve damage. We also have higher risk of cataract if you have short-sightedness. Cataract is blurry vision or fuzzy vision caused by whitish of the crystalline lens. And lastly, squint. So if you actually have high myopia leading to lazy eye, you also have squint easier, especially the diverting squint, which is exotropia, as seen in this picture here. So if you actually have myopia, you can see that this is low myopia. You have 2 times risk of cataract, whereas high myopia have 5 times risk of cataract. So the risk is higher with high myopia. So you have 14 times risk of glaucoma with high myopia, 13 times risk of the retinal detachment with high myopia, and 845 times risk of myopic maculopathy with high myopia. So you can see that compared to low myopia, especially myopic maculopathy, is 14 times versus 845 times. So it's best to keep the myopia as low as possible. So the bad news is myopia cannot be reversed. It's something like the size of your feet. If you are 8 size feet, it will not reduce to 5 size feet. So if you are -6, it will not reduce to -3. That is a bad news. But the good news is myopia can be slowed. So there are ways to slow down myopia progression. So today we are going to talk about this. So can we control myopia? So first thing, myopia cannot be reversed as mentioned just now. So can myopia be stopped? It will stop progressing at a certain age when you finish your puberty growth. And can it be slowed? It can be slowed with several myopia control options. So myopia and food supplements. So this is a new finding last year. So what they did was they actually tested guinea pigs. They induced myopia in guinea pigs, and they found that, you know, with omega-3 fatty acid supplementation, you can actually control myopia. Maybe one day when they start confirming the results in human, then we can start taking omega-3 fatty acid to control myopia in near future. So devices, it has been found that, you know, if you use a lot of devices, gadgets, iPads, mobile phones is associated with higher risk of myopia, greater axial elongation. So myopia will increase with too much gadget, too much near tasks. So too much reading has also been found to lead to myopia. So you need to limit it to less than 2 hours within a day. So how about eye relaxation machine? So there is no evidence, no research to support this. Okay, how about undercorrection? So the older practitioners in the market, they tend to like to undercorrect myopia, and they believe that if you undercorrect short-sightedness, it will actually control myopia. But back in 2002, there is already a researcher proving this wrong. So this is a very outdated very obsolete treatment for myopia control. So we shouldn't undercorrect the power, we should give the full power. So when an optical shop tell you that they want to undercorrect your son's power, unless the change of power is very drastic, do not allow them, because this will actually cause myopia to increase even more. So this is Dr. Chung, the researcher who actually found this, discovered this finding in his research in 2002 for his PhD project. So spectacle lenses that control myopia, I will only introduce those that have more than 2 years research findings, and also those with more than 50% of control. So the first one is by Hoya, a lens by Hoya with M first letter on the branding. You can see the branding there. So they actually did a research on Chinese school children. Their initial research is about 2 years, but till now it's about 6 years already. They have found that there is effective control, and also they have found that it is maintained control, meaning the result can last for several years rather than there is a rebound after certain amount of years. So the design is like this. You actually have a center clear zone at about 9 mm. Then you actually have a honeycomb area around it that is plus 350 addition. So this defocus area at the side will actually cause a peripheral myopia, leading to control of the power. They believe that if you can induce a peripheral myopia, it can actually control the myopic, the eyeball elongation. So the control that they found was 52% on myopia progression and 62% on axial length elongation. So the second lens is the HOT technology. HOT technology is from Essilor. So HOT technology has also more than 2 years of research finding. So they actually did it in China. The first study was done in Hong Kong, the Hoya study. So why do they choose Chinese as their study research subject? Is because the Chinese tend to be more myopic. So this one, they did it on school children, and they actually take into consideration wearing duration. The wearing duration is about 13.5 hours per day, meaning the full day, full awaking hours, and for 6.5 days, almost every day on the lens. So they found that there's 67% refractive error retardation power control and 60% axial length control. So their design is also relatively similar, although different. They also have a central clear zone, central power zone that is 9 mm. Then they have a peripheral lenslet, high spherical lenslet technology. So this peripheral area is their aspherical defocus, which they also induce a myopic or short-sightedness defocus at the side, at the periphery. So then we look at alternatives. Of course, it's not limited to spectacle glasses, because there are cases that it will not work, or it will not work as effectively as we wish it would. So the first alternative is Cooper Vision MySight, which you can also find in selected focus point stores. So this is also a similar peripheral myopic defocus design from Cooper Vision. So this is a daily disposable contact lenses. You throw away the contact lens every day, replace them every day. So it's very safe to wear for children. children as young as 7 to 8 years old can actually wear contact lenses. So then we have Auto K, is something that we only offer in Opulence Gurney Plaza because of the specialty, the skills needed, and also the time consuming chair time. So this one we only offer in one outlet. So this is you sleep with the lens and you wake up with removing the lens and going to school with clear vision. So this one also induces a peripheral myopic defocus, and it is very effective. The only downside is you have to sleep with the lens, so there is a higher risk, there is a small risk of infection, so you have to take good care of the lens. So then we have a therapeutic approach through atropine. So we encourage atropine as well because it has been found that if you combine the therapy, contact lens and atropine, or glasses and atropine, it is much more effective. So we encourage this as well at Focus Point. So atropine from 0.01% to 1% is found to have effect on myopia control, but we seldom use a high dosage because it has been found to give us side effects. It has been found to have a lot of rebound effect, so we normally recommend the lower doses like 0.01 or 0.025 or 0.05. So why we mention low doses because of side effect, but nowadays there is research by Lam that shows that you need at least 0.05 to give effective result. So nowadays there is several school of thought, some people going for 0.01 and some people going for 0.05, but this is a nightly drop, one drop every night into each eye, so it also has been strong results to provide myopia control. So time spent outdoor is also a way to control myopia. This is a research in China, in Guangzhou. They actually found that by including 40 minutes of outdoor activity in the students' daily curriculum, it can actually control myopia. So outdoor activity and sun time is very important for myopia control. So this is something new. Low level red light therapy has been found to have myopia control effect, but it is still very new in the market and not enough research to support. But this repeated low level red light has been found to be a new myopic therapeutic intervention. So more research need to be done to provide an affirmation of these findings. So points to consider. First, did you know that during the MCO time there was something called the quarantine myopia? Because of too much near work and too little outdoor time, myopia actually increased during the quarantine time of during the pandemic period. So measuring myopia control should be done very often, 6 months once, especially when you go on a myopia control program, because it will actually tell us whether the control is good and whether we need to opt for combination therapy or alternative therapy. Then this is different schedules of myopia control. The first visit should be 1 month, following that every 6 months. So some people actually query or argue that we should not go on percentage when we measure myopia control, but till now it is still the most popular technique because a lot of practices do not have axial length measurement or biometer, so we just measure the power. So till now it is still the most popular technique and easiest for practitioners to understand. So when should you change myopia control treatment? Here, according to Walin and colleagues, he actually recommended if the increment is more than 50 a year, we should change it. And also, is monotherapy better than combination therapy? The answer is yes. Anything with atropine is better than atropine alone. or the spectacles alone. So here in Focus Point, we hope to be one of the pioneer to encourage combination therapy. We work with ophthalmologists within the region to promote combination therapy. So you can actually get glasses from Focus Point, and we can recommend you to a nearby ophthalmologist to get your atropine. So there are studies done combining contact lens and also atropine. There's also studies done combining Myospart with atropine or Stellus with atropine. So it has been found that it is quite effective. So should we apply myopia control treatment before myopia onset? So answer is we should. Reason is because myopia has a lot of increases a lot of risk of diseases. So it is actually best to start myopia control as soon as possible, as soon as the child has myopia. So when to start in myopia management, Boulemont and colleagues actually recommended that you should start myopia control in children that is school going, because there's a lot of near work, a lot of studying, a lot of tuition, a lot of assignments. So once they go to school, they should start myopia control. So when to stop? So myopia actually stops around after 18 years old. So research has found that it can stop around 18 to 24 years old. So you can stop the myopia control once your annual review shows that the myopia has actually stopped progressing. So it is very individualized because it's different from individual to individual. So there's no hard and fast rule to say if it's 18 or 24. So here they recommended between 24 to 27 years old to stop myopia control. So meaningful myopia control is 30 to 50% a year. And this will be about 0.25 or more control a year. So research has also found that if you have irregular sleeping pattern, very late sleeping time, very short sleeping duration, this can actually lead to myopia progression or myopia. So what is effective? We bring all this together: outdoor activities, 1 to 2 hours a day for sufficient UV exposure, reduce near work, limit to 2 hours after school a day, wear correct glasses, correct power, myopia control glasses, like what I mentioned just now, the Hoya and Essilor brand has a robust study and also more than 50% efficacy control. Atropine 0.01% to 0.05%. Autokeratology contact lenses, MySight contact lenses, combination therapy with atropine, the contact lens with atropine or the spectacle, myopia control spectacle with atropine. So do make an appointment, see our Focus Point optometrist today to control and manage your myopia, especially in children, because myopia is not only a blur vision, myopia is more than that. Myopia can actually cause a lot of other diseases if not controlled properly, if it has gone to a degree that is too high. So do call us, make an appointment to see our 190 optometrists at Focus Point today. Thank you.